Hi, I'm Dr. Philip Macmillan, and today I'm doing an interesting action. I am working with someone based in California who is a member of the public concerned about some of the patterns that we've been hearing in the news. And what we're doing is we are now having a conversation about what is happening, what is scientific, what could be misinformation, to try and see if we can make sense of the same questions that you are asking yourself on a daily basis. So, without further ado, let's bring to the stage Julia. Julia is based in California. Julia, do you mind just doing a quick introduction of yourself?
Sure. Well, my name is Julia Elhaj. I am a wellness strategist and marketer who focuses on health and wellness marketing, branding, and strategy. And I also was an elite athlete in my prime, and I've practiced for about 20 years, and I know a lot about what elite athletes put on, the demands put on their body and their mind. And I've just taken an interest in the current health dialogue that seems to be affecting athletes more and more these days, and the general discussion about what health and wellness really means.
Excellent. No, that's very interesting. If you don't mind me asking, Julia, what was your area of focus as an elite athlete?
A volleyball. Yes,
Ah, so
yeah.
so
Back in the
you
day, I
know,
played for
yeah,
Boston College and was on my way to the national team before I got injured. So
wow, wow. So
yeah.
you have a great understanding of what these elite athletes go through and the importance of staying injury free in order to have a professional career.
Absolutely. I think all athletes use their body as a tool. We're not looking for average, we're looking for optimal, because the better shape that we are in, the better we are able to push our limits and perform and do those amazing feats that, everybody is amazed to watch, during plays or competitions.
Excellent. So let's get to our first case. And we're going to be looking at this specific case. Deion Sanders, 57 years old, NFL. Not everybody watches American football, and he's a current coach at a University of Colorado. Can you tell us a little bit more about him?
Well, he's one of the most dynamic and versatile athletes in American sports history. So he is pretty much an icon over here. I think some of his stats was he played for the Atlanta Falcons and the San Francisco 49ers. I think the Dallas Cowboys, Washington, and the Baltimore Ravens. He's got tons and tons of accolades. The 8-time Pro Bowl player, 6-time first team All Pro player, a Super Bowl champion. So he is quite the specimen and
Wow.
the athlete. Yeah. He's the only athlete currently that was able to play in the Super Bowl and the World Series. So he set the bar pretty high for everybody. And the reason why it caught my attention is that, most athletes who play at that level will have wear and tear and, maybe, especially for football, injuries in terms of, maybe shoulder or hip or knees, because there's just such a high impact sport. But when athletes who pretty much have a very, very healthy lifestyle come down with certain types of cancers or autoimmune diseases or just diseases that are debilitating, it sort of raises a red flag, especially after everything that happened with COVID.
Okay, so we'll get to the straight to the point here, because what you are concerned about for people around you, family, is whether or not this individual could be having a vaccine injury. Is that really to the point of what we're talking about?
Yeah, yes, I think it is a relevant question to ask was the vaccine, a proponent in stimulating and triggering this disease within his body.
Okay. All right. So let's look at the timeline, because you've done some work here. You've put this together. So pre-2021, he was active, elite coach, no public chronic conditions.
Mm-hmm.
And so he was another one of the proponents pushing the COVID vaccination. Is that why we know in August that he was vaccinated? Do you remember?
I believe so. I believe a lot of athletes came out as a proponent and pushed the vaccine as something that was safe and effective. There were, that was a very divisive issue. Some athletes were very for it, and some athletes were not. Once again, the medical advice that certain athletes get, and especially the higher up they go, the more trust they put in the medical professionals that are surrounding them. So it is, for him, I am sure that he trusted his team of medical professionals, and they encouraged it. And then, he felt safe. And I'm sure that's why he felt that he would encourage other people to follow his lead.
There's an important point here that I said previously with regards to tennis players. I've done some research as well for elite tennis players, and the fact that Djokovic was one of the few left at that age who was still able to play. And I think the point I was making is that the data told us very clearly that the highest risk were in older people with specific comorbidities. For people who had no comorbidities, fit and healthy, the risk was exceptionally low, which would be elite athletes. Mm-hmm. And when a recent global study looking at COVID outcomes and talking about the amount of lives that were saved by vaccinations, one of the things that stood out, and I think it may still be an overestimate when they said 2.5 million lives saved, they highlighted the fact that in the 0 to 20 age group, that means young children, only 299 lives would have been saved globally. Yeah. Elite athletes would have fallen in that kind of group. Yeah. And so the question is, why would anyone around them, knowing that they don't know medium or long-term impacts, actively encourage this cohort to do this unless it was deliberately positioned so that it would encourage the general population to do it? So in a sense, they kind of sacrifice the elite athletes with the hope that there would be no issues, because at the time, as we can see in August 2021, it was only within 6 months. You cannot know medium or long-term impacts. And so at that stage, you are hoping that everything will be okay. All right.
Yeah, I think it was probably financially incentivized, because when the world locked down and they were locking down the stadiums and they didn't want large groups of people to gather, they were like, how can we execute this quickly? I think that the owners of the teams, the coaches of the teams, the trainers of the teams, if they truly valued their athletes and their franchises and what those athletes do and how they perform, they would have been much more cautious than to just say, okay, everybody get this, vaccine so we can move on with our day. The people that are getting injured and that have either passed away, or have very debilitating, if you want to call it turbo cancer, are the elite of the elite. I mean, we hear about cyclists who, end up doing their race, finishing first place, and then he dies in his sleep. Or, Deion Sanders, who was pretty much healthy, just with minor wear and tear injuries that he needed to do, or perhaps a genetic predisposition, of just old age. I mean, we all do get older, so we can't say, we're going to be scot-free for the rest of our life, but then he comes down with something very debilitating. So I do think that it was just, let's get life on and let's move forward. And I do think that most people think vaccines are necessary. The story that everybody has in their mind. They've saved millions of lives, and that's how society has moved forward, and we have not died off as a species because we have come up with this medical miracle. And we sort of put all of our eggs in one basket, and we just say it's only vaccines that have improved the health and wellness of our humanity or species. And I just don't think that that is accurate. I think there is, multiple factors at play in that. And I think that, unfortunately, money talks. And I think that's why everybody was pushing, like, just take the vaccine. And, if the leaders of the team take the vaccine, obviously the other teammates are going to look up to them as an example and follow suit. And, that's just human nature. And I think that's what happened.
So someone listening could argue, at the end of the day, he's still not an elite athlete anymore. He's in his 50s. We don't know his comorbidities behind that. And so therefore, maybe there was a good reason why, based on his risk factors, he would have been encouraged to take the vaccine. But you are completely correct. It's one thing to ask the coach, because of his age and his comorbidities, to take the vaccine, but when promoting it, they should have been promoting it to other high-risk people who could have benefited from a reduction in the risk for severe disease. That's my thought on it. So let's come back to this question on the COVID vaccination and just quickly look at the timeline.
Okay.
So as I said, he was vaccinated in August 2021, and then between September and October, he develops severe blood clots after foot surgery, arterial clots, 3 surgeries, 8 surgeries in 3 weeks. So this does suggest that he may have had some underlying issues, because the foot surgery, it doesn't sound as though it was emergency, and he did have a history of foot issues from some injuries in the past. So my presumption clinically would have been that he had an issue with his foot. He needed to have some things addressed. He had been vaccinated before, and then when he had what would have been routine surgery, he then had complications post-operatively with severe blood clots. Okay?
Mm-hmm.
So from a clinical point of view, the question would be, if he hadn't been vaccinated, did he have other risk factors that could have caused this anyway? Was this purely coincidental, or was it relevant to the vaccination? The time frame looks like about 30 days. If we're right, depends, between 30 to 60 days, depending on when he was vaccinated. And so he may have fallen outside the 28 days that they tend to look for, or sometimes up to 42 days, where they would think that this could have been connected with regards to vaccination. And so straight away, the clinical community would start saying they think that this is purely coincidental. What would you say if you heard them saying that?
I have a little bit of trouble with that word coincidence. I don't know, I mean, so coincidence is a hard word for me to swallow. I think there are, and also it's hard to, these discussions bring up other questions you should ask about any human being before you vaccinate. I mean, most of the studies done on any medicine or any vaccine, I mean, they do not say, okay, we have a cohort of African Americans and we've tested this medicine out on this group of people. And then we've also done it for women, and we've done it for African American women, or we've done it for Asian women. I mean, we all have to understand that we are all very biodiverse in our genetic makeup. So there is no one size fits all medication for any person. And you have to know that when you take a medicine, I mean, I have this also. I mean, the epidural is very common for most people and most women when they give birth. And it almost killed me in all 3 times. And I was not able to take that. But most people will say it's very safe, it's very effective, you're not going to have any complications. And that just was not my experience.
So you're touching on a very important nuance, and you're right. And I think part of the lesson that is coming out of the pandemic is that a one size fits all, especially in a disease that is poorly understood by the scientific community, is exceptionally dangerous. I've always said that the scientific and medical community should have spent more time sharpening the axe of their knowledge before trying to develop therapies that would be used broadly across a population. I think that history will show is that fundamentally that was a poor approach in terms of the strategy for managing the issues with regards to health. But there is one bit that I think we need to touch on, and this is the issue as to what happened subsequently with regards to his bladder cancer. So after he had all of these things, because it wasn't just the surgery in September, October, then he needed amputation due to ischemia, which suggests peripheral vascular disease. Then he had persistent vascular issues, longer term surgery for blood flow restoration in his leg. So in the first phase, this could just be, as we said, that word coincidence. However, what it indicates is that underneath this is that because peripheral vascular disease doesn't just appear, right. It had to have been there in the past, and it could have been from his previous injuries and his previous surgeries. But the question that is very difficult to know is, did the inflammatory response around COVID vaccination, because this doesn't happen to everybody, but in some people, if it's related to the spike protein, because of the macrophages, there's a specific group of immune cells, macrophages, that if they become activated, and this can happen from infection or from vaccination, it can then drive the plaques that are already present. So meaning that if people already have plaque disease, which I'm saying that based on this, he probably had that in his legs beforehand. And so the question is would that process have been accelerated, which then led to some of the complications that he had down the line? Very difficult to know. And this is why I'm saying is that the medical community would say, if we don't know absolutely for certain, we are just going to leave that to the side. Now, if it's happening to lots of people, it's then much more difficult to answer. The issue that I want to come to, however, is this point here with regards to what happened next. So in April 2025, during a normal workup, he's found to have bladder cancer. Mm-hmm. And this then requires a radical cystectomy, which is a removal of the bladder, and bladder reconstruction. Now, I don't know the details as to exactly what type of bladder cancer he had, but the mere fact that they did such a radical surgery suggests that it was probably at least at stage 3, infiltrating the surrounding tissues. And this is, I guess, the other part that people are asking about, this concept of turbo cancer. And I'm sure you have heard the term. Yeah. When you hear that, what do you think of?
For turbo cancer, like when I hear the term turbo, I believe that if someone had an underlying predisposition, or they had the disease and it was just undetected because they didn't express any symptoms, when they were introduced to a synthetic mRNA, that protein just accelerated their disease. And that's why it goes so fast, from stage 1 to stage 4. And So that's what I think when I think of turbo cancer, and how rapidly it goes. If I understand correctly, natural mRNA doesn't stay in the cell that long. It disappears quite quickly once the protein that the cell is requiring to build is expressed. And this, right? And then the synthetic mRNA is coming from a code on a computer. Isn't that how it is?
Well, I'll explain it a little bit more clearly. In order for the immune system to not destroy it immediately, because this is what you're right, as soon as messenger RNA, normal mRNA to produce proteins is formed, makes the protein and it's destroyed. And that's the way how the body addresses it. However, they needed more time for the cells to make spike protein. And so instead of using the normal building blocks, which are 4 nucleosides to make the RNA, they changed one of them, the uridine, to methyl pseudouridine. Okay. And by changing that around, it then takes longer. 2 things happen. One, it's able to evade the normal destructive mechanisms with interferon to stop it being produced, because the cell has a kind of protection mechanism. So it bypasses that to allow time for the spike protein to be formed. In theory, they thought that, you know, if giving you a time limit, so imagine that messenger RNA is destroyed in 1 minute. They were hoping that the adjusted RNA, the modified RNA, would be destroyed in, say, like an hour. So it would make it more time to make spike proteins and then get destroyed, and then the cell gets destroyed. And to be frank, I don't think they were worried too much, because they thought that even if the RNA continues to produce spike protein, the immune system would still destroy the cell. Okay? And that would be the end of it.
In theory.
As we've learned, assumptions don't work in the real world. Right. For some reason, some cells are able to pass it on through exosomes to other cells. Some cells, what happens if it goes into a cell that is able to evade the normal destruction process? And these are now the questions that we have now, where we're seeing patterns where the RNA is now being produced for over 700 days now in some people. It's important to note that is not everybody. And I think that there are going to be some kind of predispositions for the people who this is occurring in. But the point is that there does seem to be an underlying immune issue ongoing that occurred after in some people. And therefore, that now leads me back to the cancer. When I looked at it, what I was saying was occurring. So the problem is the word turbo cancer. Turbo cancer gives the impression that the cancer is very rapid. Okay? But that's not really what we're seeing. What we're seeing is that normally, if you imagine a cancer is tiny, it then gets a little bigger. So it's a millimeter size. Then it grows 10 times. It becomes a centimeter. Then it becomes 3 centimeters. When it's about that size, for example, it then starts to spread into the tissue. Then it starts to spread to the lymph nodes. Then, after it has spread to the lymph nodes, it then will get into the bloodstream and spread distant. And that's what we call metastatic disease. Okay?
Okay.
But what happens if the cancer, instead of doing the normal spread from getting bigger, going into the surrounding tissues, then going to the lymph nodes, what happens if at 1 centimeter it suddenly starts to spread everywhere? So it becomes stage 4. It's kind of like, so rather than calling it turbo cancer, it appears almost like it will go from stage 1 or 2 to stage 4 very quickly.
Right.
And it kind of skips some steps. So when people think of turbo, they think that the cell, if you looked at the cancer in the tissue, it would be growing at a rapid. It's not necessarily that it's growing at a rapid rate, as much as the fact that it has evaded all of the protection to be able to get to a distant site in a way that it wouldn't normally be able to do.
Okay.
Does that
Yeah.
make sense?
That
And
does
so
make
what
sense.
we're seeing now is not necessarily, I mean, there is some increase in cancer, but what is very difficult to put in the public arena is the fact that instead of them presenting just with cancer, say a breast lump, you may find somebody when they come with the breast lump, they've also got it spread to their lungs and their brain. And so suddenly now, just doing a mastectomy doesn't work because it's already gone.
Right. It's every.
That's where we are having the issue, and it's a very subtle difference, but because the scientific community has already got it in their head that turbo cancer is an anti-vax term, as soon as you use it, they shut off and they stop listening.
Yeah. Yeah. I don't know. I think this anti-vax fear is paralyzing to all of us. And I think it's very hard to have a very honest discussion about what's necessary to look at, just all of us in every country. We really do need to have the ability to say it could be this, and we may have made a mistake by rushing through this too fast. And I think so many people are afraid to say that because I do think it will come with a tremendous amount of grief and regret that we didn't know what we know now. And I guess for me, I think if you go back and you look, there were very, very clear signs that rushing through something like this is a terrible, terrible idea. And I think many people knew this, but I think they needed something to try to push it over that hump to get it accepted, because I think that the platforms and the potential of it on paper and the cost savings that they would be able to do to bypass the old way of building and constructing vaccines was just too magnanimous. It was just, this is a cure-all. And I just don't think that the human body was ever designed to be like that. It's a very complex, living, adaptable organism. And each one of us, we each have a separate thumbprint. We are as diverse as it comes. And you cannot introduce something like that to the public without being very, very cautious. And I just think we threw caution to the wind. And it's unfortunate. It's really unfortunate.
I think I agree with you on that. Certainly, Julie, I agree with you. So in wrapping up here, the consensus that I would say when we look at this case, the timeline for his vaccination, the events that occurred afterwards, the clinical community is unlikely to say that you can make a direct connection. But I do think that the inflammatory process, as I said, with monocytes could certainly have accelerated the vascular issues, which then led to all these things, and potentially down to the bladder cancer as well. But it's very important that the requirements almost for being a definitive cause are very high, and if you go back historically and think about what the smoking lobby did, even though there was pretty clear association, they said to the scientific medical community is, if you think that smoking is the cause of cancer, show us the science where it is. And they couldn't. What happened was it became an epidemiological association where it was so blatantly obvious that people who were smoking were at higher risk for conditions that they had to concede the association. It may be something like that would have to happen, but sadly, that may take 10 or 15 years.
Yeah,
that is not going to happen quickly. And so this is the challenge that we are up against. But I think that the process of discussing the science and reflecting on it is very worthwhile to give an objective analysis of what is happening. So we're just going to wrap up. I'd like your final thoughts, Julia, and we will try and do this again. But go ahead. What are your final takeaways?
I think, well, I just appreciate the time to sit with you and get a clinical perspective, obviously, and to increase my own knowledge about what's going on. But I do think that athletes are a canary in the coal mine, and they are the top of the top. And when they start expressing diseases, or they start falling on the field in increasing numbers in a short amount of time, that we should probably pay attention a little bit more. I know most people think athletes are, superhuman. And sometimes I think that they don't get enough compassion from the general public because, they're not seen as really just human. So I think we overlook that and bypass it. So I just appreciate just looking into it. My heart goes out to all the athletes that may have something like this, or that they're going through something like this, who've dedicated their life to their health and fitness and keeping themselves healthy, and as an example for everybody else to follow. And then if it is not a coincidence, that they would just, that they just get the help that they need, and that someone is brave enough to tell them the truth so that they can actually either get screened and that they can know what they're up against, or that they get like Deion Sanders. I mean, he has a team that acted very fast, so he happens to be lucky just from his fame and circumstance. But yeah, so anyway, I do believe that, we should be paying attention a little bit more to those people that, are the top of the top in health. And if they start falling down, we should be asking harder questions and better questions.
Excellent. Thank you very much, Julia, and really appreciate your input. So if you just wait with me for the outro, and we will have a chat afterwards.
Okay.
Thank you.